Dr. Leana Wen is the Baltimore City Health Commissioner. Since her appointment by Mayor Stephanie Rawlings Blake in January 2015, Dr. Wen has been reimagining the role of public health as being critical to all aspects of urban revitalization. Her transformative approach involves engaging hospitals and returning citizens in violence prevention, launching one of the most ambitious opioid overdose prevention programs in the country that is training every resident to save lives, and implementing a citywide youth health and wellness strategy. And I just might as well be frank with you. She's the commissioner in Baltimore, which is my city, and I think she's probably one of the best commissioners in the country because of her expertise, her competence, her passion, and her compassion. Dr. Wen.
Thank you very much, Congressman Cummings, and good afternoon, everyone. I'm here to speak about the health threats faced by communities across America. I'm an ER doctor, and in the ER, I see patients who are desperately seeking help for drug addiction and mental illness. They know that they need help. Their families know that they need help. And I tell them, I'm sorry, but the wait is weeks or even months. Some are able to wait. Some go home, overdose, and die. The opioid epidemic is sweeping our country, and we know that addiction is a disease, just like diabetes and heart disease. Yet nationwide, only 11% of individuals with addiction can get the help that we need. Would we find that acceptable for any other disease? Would we say to a patient with chest pain, I'm sorry I can't treat your heart attack today, but come back in 3 weeks. Maybe I can see you then if you're not dead. During the primaries, every candidate from both parties talked about their personal stories of addiction. That rhetoric needs to be accompanied by a commitment to action. We must fund what works, like medication-assisted treatment. We must start 24/7 ERs dedicated to addiction and mental health. We must expand recovery housing because we know that housing is healthcare. We must offer mental health services in the community where people are, including in our schools. And we must call out when things don't make sense. Because Congress has not approved the President's $1.9 billion to fight the Zika epidemic, the CDC has been forced to take money away from local public health to pay for national efforts. This will cut my emergency staff by a third, which is deeply ironic because these are the same staff who respond to disease outbreaks, hurricanes, and other emergencies. Keeping our country safe and well requires an investment in public health. There's a security argument. Think Ebola and bioterrorism. There's an economic argument. One child born with severe defects from Zika can cost society up to $10 million. 1 year can cripple our economy. And there's a moral argument. Like so many other diseases, Zika is a disease of poverty. Can we stand by and watch generations of our unborn children suffer the consequences in communities that are already hardest hit by legacies of discrimination? Congressman Cummings talks about going beyond common ground to find higher ground. And I want to end with an appeal to a higher aspiration. Can we channel our angst about addiction and mental health into a national plan that will make us the global model for treating patients with urgency, rigor, and humanity? Can we go beyond whack-a-mole emergencies and implement a sound preparedness plan for health that makes our nation safer? Can we go beyond thinking about health as health care and aim for well-being for all so that where children live does not determine if they live? It's been said that the currency of inequality is years of life. Well, public health is a powerful tool to level that playing field, to bend the arc of our country away from distrust and disparities and back towards equity and justice. That is our highest aspiration that I urge the Platform Committee to take on today. Thank you.
Questions? Ambassador Sherman.
Thank you so much for that. I'm also a Baltimorean. So thank you. I associate myself with the chairman. 35 years ago, I lost my younger brother to addiction and depression. And we knew much less than we know now, and we were a family with resources. I was a trained social worker and could not help. I think this is a staggeringly important problem. We have to get past the bias. We have to get past the prejudice. We have to get past the sense that someone who gets addicted to drugs or has depression or mental illness is somehow other than the rest of us. This exists in every family, somewhere, someplace, somehow, and we need to bring it into the daylight and talk about it. It's why I'm always willing now to talk about my brother and what he went through, what our family went through, and what we must do to stop this. So thank you very much.
Thank you.
Thank you. Thank you, Ms. Schaefer.
Thank you, Ambassador Sherman, too. And thank you, Doctor. This is, it's a huge, huge health problem. And yet, I agree, it's not looked at as a health problem. The stigma around mental illness and addiction is just as bad or worse than it was around AIDS, and it has to stop. You're right. You know, if I walked into an emergency room and said, I'm addicted to drugs, I need help, you know, it would be a big different story than if I said I have chest pain or I broke my leg. So, you know, it was a very great analogy that, you know, and I think that this committee really needs to look at this. It's about time. Too many of my friends have died. I grew up in the drug culture of, you know, the 60s. And, you know, if you didn't get clean, you died. Too many of my friends are depressed. And, you know, it's an issue. So thank you for bringing that to light. Thank you.
Mr. McKebbin.
So I've spent my life in remote rural areas, so sort of the opposite of your beat, but now the places that offer some of the highest opioid addiction rates in the world. So I was really grateful for all your suggestions and demands, really, about what we should be doing in terms of treatment. I don't know the answer to this question. Should we also, I mean, I know a lot of people who were prescribed opiates for pretty casually for things and ended up having their lives wrecked by it. Should we be thinking about that end of this funnel as well as we're working on this?
So thank you, and thank you all for sharing your various stories as well. It's time for us to get out from behind the veil and talk about how we have been treating addiction not as a disease but as a crime, and that is inhumane, it's ineffective, and frankly it is unscientific, and that an addiction is something that affects all of us and all of our communities. We talked about intersectionality. There's such intersectionality with human rights, with civil rights, with criminal justice reform, and so I'm glad to be speaking about that. To your point, you know, it is very important for us to focus on the prevention aspect. And certainly, we can't just look at doctors overprescribing medications without also looking at the misleading tactics used by drug companies to market pain medications over the years, to the point that there are about 259 million prescriptions of opioids given per year, which is enough for one for every American. So looking at the overprescribing is a big part of it. But we also know that there is a big treatment gap. And that's the issue that I have too, that we can't just talk about saving a life, which we completely agree with in Baltimore. We have one of the most aggressive overdose campaigns, thanks to Congressman Cummings and his leadership there. But in addition, we can't just save a life today. I feel like we are treading water unless we can get people into treatment at the time that they need. And we know what works. The science is there. That's the frustrating part. We know what works. We just have to get funding to get there.
Barbara Lee.
Thank you, Dr. Wen, very much for being here, for your testimony, for your work that you do each and every day. I listened very carefully to what you said, and I really appreciate your making the suggestion that we come up with some kind of a plan to address addiction and mental health. I'm a clinical social worker by profession. want to ask you, in this plan, there have been so many young African Americans and Latinos who've been put in jail, and they should have been put in rehabilitation and in treatment. So as we move forward to talk about how we develop, as Democrats, a plan for treatment and rehabilitation and prevention, how do we make sure that it's broad enough to include those who may still be in jail for some addiction issues, and they should be in treatment and rehab? And so we have to really look at that as not only prescription drugs, opioids, but every type of addiction that has unfortunately disproportionately incarcerated people rather than put them in treatment and rehab.
3 things. First, every interaction needs to be the opportunity for intervention. If someone is incarcerated and they have a mental illness or addiction, they also need to be provided treatment at that point. Second, we have to switch how we think about individuals with addiction or mental illness, that it's not a crime, it's a disease. We don't incarcerate people for having heart disease. And so we have a program in Baltimore that we're starting where individuals caught with small amounts of drugs are going to be offered treatment instead of incarceration. And we have to look at programs like that and expand them. And third, I believe it's very important for us to look at our people as resources. We hire individuals who are in long-term recovery to work on our needle exchange vans. We hire individuals to do counseling. We strongly believe that people are the solutions, not the problems.
Representative Reese, and then Ms. Tandon.
I want to thank you for your testimony as well, and just following up on what the Congresswoman just talked about, because that's the biggest thing that I keep hearing from a lot of constituents, and particularly African Americans, is, you know, when it was the crack epidemic, it was considered you're a criminal. You're going to jail, and we threw a lot of folks in jail. And so I guess for us, having some kind of bold statement, many people don't get treatment until they're actually in jail for mental health. So the 3 things that you pointed out, is there a statement that you think, I guess it would be a strong addiction statement that would include not only heroin and opioids, but also acknowledge that the crack epidemic that has destroyed many in the African American community is also a disease? Is there some strong statement you think we should start with and then talk about what are the action steps?
You're right. We need to acknowledge that everything we're doing now is coming too late for too many people. And I see this in our community, and I see our residents saying to us, why is it there are people who have been dying from overdose for decades? Why is it that now there are white people in suburban, rural areas that are dying that we suddenly care? And I do think it's important for us to call it out and say, yes, that is an injustice. Yes, there are historical policies of discrimination that have led to where we are, but this is our opportunity to make a difference. And so let's save a life today, get naloxone into the hands of everyone, because if we can't save a life today, there's no hope for a better tomorrow. Then let's get everybody into treatment at the time that they need, instead of looking at it as a criminal justice issue. And then let's also address that people may be taking drugs and becoming addicted in part because of deep trauma, spiritual trauma, emotional trauma, because they're not sure what is on the other side, whether it's jobs or housing, or we need to provide all these other things that also make life worth living.
Thank you.
Stand in.
Thanks. I'll just be quick. I definitely think that I'll just say this, I think the platform definitely has to recognize the importance of addiction problems for all communities, and that it is an injustice that that we traditionally think of criminalizing some addictions and have for many decades, and are now talking about these issues as a public health crisis. We should have been thinking of them as public health crises all along. That doesn't take away from the fact that a public health analysis is a proper analysis. Earlier today, there was talk about the inequality of death and how there's rising mortality rates for white working class people in the country. Professor Eaton did a great study on this, and the cause of that, as far as we know now, is actually not health insurance rates, but truly drug addiction and suicide. So that is a large screaming sign of some major problems we have from a public health perspective. What kind of levels of investment should we make to address these challenges? Also recognizing that it shouldn't just be about these addictions, but broader addictions as well.
We need to make a conscious effort to identify the problem, but not just, it can't just be enough for us to talk about the experiences. And I think this is my greatest frustration, that I hear legislators on many sides, and I hear people talking about the individuals that they're meeting who are telling their stories of losing a loved one, not being able to get a loved one into treatment. But we need to follow that up and say, let's invest in this. If we said curing Alzheimer's or curing cancer is a goal, we would be expecting a financial investment into that. And that is why it's important for us to identify this as a problem. We have to call it a problem, but then treat it as well. But related, so closely related to addiction is trauma and mental health. And we have to remember to also invest in early identification and prevention, not just to say to somebody, you have to wait until after you get a diagnosis that we treat you. But how can we build resilience in our children? How can we develop trauma-informed practices in our communities? And how can we invest in those and invest in public health as a way to make our communities healthier and our nation safer?
Let me just, before you leave, just leave you with this one thought into the committee. I remember when we had the Ebola crisis, there were some in Congress that said it'll never get done. There were a lot of naysayers, but we dealt with it, did we not? And I mean, I guess that's that can-do attitude that you're talking about. Is that right?
Absolutely. If we ever have a patient in front of us who is dying, it would never be our option to say, this patient is too complicated. I can't do anything. And I see the same thing for all these health issues that we face. There are so many examples, and Congressman Cummings knows this very well. In our city, we have a program for infant mortality that within 6 years has closed the disparity between black and white infant deaths by 40%. That has decreased the percentage of children dying in their sleep, babies dying in their sleep by 50%. That has reduced teen birth rates 36% because of the reproductive health education and services that we do. There are great examples like that across the country, and we can expand it and make this the national model for the U.S.
Thank you very much. Thank you, thank you, thank you.